protesting today at the Department of Health and Human Services. Today, we're advocating for people with ME, CFS. I'm here because I have a daughter who's been severely ill for over 20 years. It's been hard. The people in our family have had to deal with enormous emotional, financial, and health complications that arise from this illness.
My name is Susan Kreitzer, and I have been ill since 1991. 3 years ago, I became so severely disabled that I was no longer able to work as an attorney. The full name of this illness is myalgic encephalomyelitis, or chronic fatigue syndrome. This is often an invisible disability. We often look fine, but many are severely disabled. This belittling name, chronic fatigue syndrome, sounds like we are just tired and does not reflect the seriousness of this disease. But it makes it easy for our government, our medical community, and the media to dismiss and ignore those of us who suffer with this. However, if you have ME, CFS, it is not easy to ignore this illness. It stops your life. We lose our ability to work, to attend school, to have a social life. Many are bedridden with this illness using wheelchairs. Some have died early from leukemia, cancer, suicide.
I'm the spouse of an ME/CFS sufferer. There are 1 to 4 million Americans who suffer with this illness. More than 17 million people worldwide. The U.S. government, media, and medical communities have all delegitimized this illness.
My name is Rafael Gutierrez, and I was the co-worker of Susan Kreitzer, who is ill with this disease.
I have a friend who could no longer live with this disease. And she decided she and friends were going to help her kill herself. And that was her solution. Unacceptable. We need more research. We need more help for people with this disease.
My name is Andrew Adel, a fellow ME/CFS sufferer. For the past 4 years, I have been unable to work. For decades, the ME/CFS sufferers were dismissed and minimized by the medical community, by the public and the government. It is imperative that the suffering end. This is a real disease, no different from cancer, diabetes, or HIV.
I'm the mother-in-law of a sufferer. There has been very little federal money, research money, spent to find the cure for this disease.
Everyone feels that this is an infectious disease. We're looking right now into whether this is a retrovirus, just as HIV was a human retrovirus. And a retrovirus goes in your body, changes the DNA, and stays with you forever. And our government chose to sweep this illness under the rug and gave it the name chronic fatigue syndrome, so as to not have a panic in this country that there could be another infectious disease. And we've been living with that over 30 years. This is affecting children. So we need to get the word out. The truth must come out.
We are protesting today to demand that Obama and Sebelius, the head of the HHS, take the following steps. The first step is to protect the nation's blood supply. Ban people with ME/CFS from donating blood and contaminating the blood. Secondly, fund research centers for chronic fatigue syndrome. including the Whittemore Peterson Institute. And the third is fund fast-track clinical trials. The last is act on the recommendations of the Chronic Fatigue Syndrome Advisory Committee. This committee's advice has never, ever been heeded.
Trials now, clinical trials now, clinical trials, clinical trials.